If a loved one, this is like the second time I'm making this, but because of the way the algorithm is set up, sometimes when you say the same thing twice with two different videos, it reaches two different audience. Of course, largely your audience. So if you're in the second time, you benefit from the repetition. But some of the things we are teaching you, we learned for 9 years. We are put in spaces where they are repeated to us over and over. So the fact that I can take complex concepts like this and break it down to you is born from the fact that I allowed myself to go through the repetition that now has produced that level of mastery to where I can explain it to even somebody who doesn't know anything about it. Do you understand? So if your loved one suddenly develops sudden onset loss of consciousness, for example, or weakness on one side of the body, where the one side of the body, the leg, the arm on this side no longer works, that's a stroke. It will not happen it happens on two sides sometimes. When it happens on one side, that's like a partial stroke. I just realized 4 days ago that people think a partial stroke means one side of the body was affected and one side is good. No, one side of the body affected is typical stroke. The one that is not even typical is when everything is off. So this side of the brain controls the activity on this side. This side of the brain controls the activity on this side. So when there is, this is that happen to black people, more because we have the what's the word now? The proclivity or the predisposition to develop the risk factors for stroke. Genetically, it's more among us. So if you're not going to have this as a young person, which you should do, as an older person, you might. So you're going to show this video to people who are around you repeatedly. So I may repeat what I'm saying. Hopefully you see it and save it. Or you save this video and show it to people. Again, when you're unconscious, the decisions you're probably a very neat person, you're very hygienic, you a very excellent person. When you're unconscious, all those things you go out of the window. The people who will now decide what happens to you till you gain consciousness are the people around. It is their hygiene, their excellence, that will not apply for you until you're back to your complete senses. So that is why you benefit from teaching. You will benefit from teaching everybody around you the things you do, almost the way you do it. So that when you are not capable of, you'll be able to do, to your taste. So you save this video for yourself, so you have somebody with you, but you send it to everybody around you, your children, send to your sister, your brother, your neighbors. This one is not share video for us to have views. It will benefit us if we have views, and we'll probably make money off of it. Because this is also the type of content that should make money. So when this type of content makes money, this content makes more content like this that helps. My point is when you suddenly lose control on one side of the body, and that is your face, you want to smile, that's not smiling this way, because the side is not working again. So they smile and one side that goes, and this whole side goes off. What the person should do from that point, where that thing came from, I explained before. I don't know if the camera is clear enough to pick my veins. These are blood vessels. If you touch yourself here, at this point, here, you're going to feel pulsation. Those are the arteries. Both veins and arteries are pipes. That's how they are. They're pipes that have a lumen. And blood goes through it to everywhere. So any blood that's going anywhere is going through pipes. All the blood going everywhere. The ones that are going to your eyes from the back. The ones that are even growing your hair for you. There is blood. It's like soil where plants are planted. At the root is where everything, water, manure, everything that the plant is using is under. So the same way your hair is planted inside blood. When I pull out your hair with force, you see blood under it. That blood got there through pipes. So if for any reason the pipes are blocked, or if for any reason they break, the blood does not reach where it's going to. So when blood does not reach the brain on this side, some action go off on the opposite side, because it's this side that controls this side. So when you notice that there's no action, whether it's yourself, whether it's somebody that's around you, or somebody you're opportune to be around, just know that blood supply to this side of the brain has been tampered by either a blockage or a breakage. If you take the person to the hospital and you don't do a CT scan, a non-contrast CT scan, if you don't do a CT scan, if you stay in the hospital for 10 weeks, no matter how fine the hospital is, no matter how equipped the hospital is, and they don't do a scan for that patient, that's happened. All that person is doing is groping in the dark and hoping that they get the problem. That's all they are doing. Because the management of stroke, the first step in management of stroke is identifying which type of stroke you're dealing with. Is it a blockage in the vessel that created the problem, or a breakage? Because if it's a blockage, some people who present with stroke present with very high blood pressure. And I'm saying that high blood pressure simply means inside this place. Inside this place. That's what high blood pressure means. High pressure inside the pipes. So if there's a blockage, you will agree with me that high pressure, flush it. So if I see on CT, on a CT scan, that this thing is blocked at that time, I'll not touch the block. So I expect it probably to clean it up for me. But if this thing is broken and I'm having inside it, so if there's any healing that started happening because of the body's emergency system trying to do something before you react, and then there's still inside this place, you know that further breaking will happen. So that's why it's important that you differentiate it, so that in this case you drop the BP, in this case you don't touch the BP. Number two, when it's blocked, the most popular thing that blocks the vessels is a blood clot. What is a blood clot? When I cut you and the thing falls on the floor, the blood dries. Dried blood. It should not dry inside, but sometimes it dries for 1, 2, 3, 4, 5 reasons. It dries. So when it dries like that, there are certain things we'll give you after we see that it's the blockage. We'll give you that and just go and break down dryness, and blood will start going. And then recovery happens to almost 100% if we move early. The problem is that if this is a breakage and I thought that it was a blockage, I was, instead of doing scan, I'm guessing. And I go and give the same injection. The healing that happens, that may have happened with the vessel that broke, also happened with some of those materials that creates blocking. Just like when you tear your skin and you don't touch it, after a while the place dries to try to heal the skin. It's the same thing. If the vessel breaks, after a while something may have happened and the vessel tries to reduce bleeding by itself. And then I'll go and give the injection, not knowing that this one is a breaking type of stroke that happened, to go and spoil something that was already trying to mend it. Are you following? So I don't want your doctor to have to tell you, because sometimes again, most doctors will write it or say it, but they don't say it like this, because you cannot even say it like this for 40 persons you're seeing in a day, depending on where you're practicing, or 10 persons. And again, not everybody is extroverted like myself. I'm not everybody is a teacher. So they tell you, please go and do a scan. They're not the ones who have the paraplegia. They're not the ones. You're the one that has. So if you're waiting for somebody who doesn't have paraplegia to beg you to go and do the correct thing, I'm not begging you now. I'm explaining to you why it's important. Now you understand why it's important. Now you go and do it. But what you do is to save other persons who may not have listened to this video. So you're watching the video on your phone personally, and you're nodding your head. You're liking what you're hearing. Send it around. Don't send it fast. Send it to all the people you know. Or it may be you. And when you wish you will be there, say, you go and do CTO, go and do CTO. Nobody will hear you. You are that place. You're trapped inside your body. You're probably unconscious. Nobody will hear you. Then the video is inside your phone. You not send it out. Send it out. So when you have an emergency, the people around can know what to do. Do you understand? Send it out. You're going to see more of these videos. I'll repeat this thing a couple of times in an attempt to drum it into your ears. But not just into your ears. Move the same video around. Let people around know. So that when you're the person who is, the best decisions will be made for you. That's for that.